Good morning, everybody. Today I am going to discuss about criteria for TMT positive test and overview. We all know that the TMT test or treadmill test is a diagnostic tool which is used by various pathologists and doctors and physiologists to diagnose the coronary artery disease or CAD by monitoring how the heart responds to the increased workload. So what is treadmill test? Treadmill test is an exercise stress test when an additional workload is given on the heart rather than the daily workload, and the person have to continue with that workload for a certain period of time. And few parameters are monitored during the period, that is the ECG recordings, the blood pressure measurement, the heart rate and the rhythmic changes, and patient symptoms and perceived exertion. Now, what are the indications for TMT testing? Number one is chest pain evaluation. If a patient have angina-like symptoms or atypical chest discomfort, to determine if coronary artery disease is the underlying cause. So what is the real cause of the chest pain? That can be determined by the TMT testing. Now, CAD risk assessment. If there is any cardiovascular risk factors like hypertension, diabetes, hyperlipidemia, that means increment of the lipid in the body, smoking or family history. So this also can be detected. Now, abnormal ECG investigation. If the normal ECG is altered somehow, then also the reason can be determined by the TMT testing. Pre-exercise clearance. So determining the exercise capacity and the cardiac safety before starting exercise program in sedentary individuals with high cardiovascular risk. So these are the indications: chest pain evaluation, CAD risk assessment, abnormal ECG investigation, and pre-exercise clearance. What are the core criteria for TMT positive test? First of all, ECG changes. ST segment depression greater than or equal to 1 millimeter, horizontal or down sloping. So this should be remembered. That is horizontal or down sloping or elevation. So three things can happen. It may be horizontal, it may be down sloping or elevated. Measured 60 to 80 millisecond after the J point in leads without Q waves. So there will be no Q waves, without Q waves. So this is the ECG changes. Now, arrhythmias, new or worsening abnormal heart rhythm. Abnormal heart rhythm. That means the pre-exercise heart rate will not increase gradually. There will be some alteration in the heart rhythm which will indicate the ischemia sign. What is ischemia? Almost no oxygen or very less amount of oxygen in the blood. Now, what are the symptoms? Development of typical angina, means chest pain, significant shortness of breath or the difficulty in respiration, or dizziness during the exercise. Now, BP changes, a failure of the systolic blood pressure to raise or a drop greater than 10 millimeter of mercury. So these are the core criteria for the TMT positive test. So there will be changes in the ECG, there will be some symptomatic appearance, arrhythmias, and BP changes. So what are the ECG findings in ST segments? Now, ST segment changes are the most important ECG indication for myocardial ischemia. So the reason should be remembered well: myocardial ischemia. During a treadmill test, horizontal or so what will be the appearance of the ST segment? Horizontal or down sloping ST segment. Then ST segment greater than is equal to 1.5, ST elevation greater than is equal to 1, changes persisting into recovery phase. So these four are the changes of the ST segments which you have to remember. What are the symptomatic criteria? Number one is typical angina. Number two is dyspnea and fatigue. Number three is timing and correlation. So what about typical angina? Characterized by chest pressure, heaviness or squeezing sensation. That means, as you can see in the figure, the person is having a hand on the chest, that means there is a discomfort in the chest. That is exercise induced myocardial ischemia. That means when a person is given a certain exercise to do which is heavy for the heart, then there is a absence or the deficiency of oxygen. Next, dyspnea and fatigue. Sudden onset of severe shortness of breath or unexpected extreme fatigue at low workload may include the ventricular dysfunction due to ischemia. So the main reason is ischemia. Timing and correlation. For symptoms to be considered diagnostic, they must coincide with the objective ECG abnormalities and occur a reproducible threshold of physical exhaustion. So when a person is saying that or there is an appearance that the person is not capable of completing the exercise, so that should be a significant symptomatic criteria. So this is the hemodynamic criteria and the exercise tolerance. Blood pressure response. Now, two examples are given. Positive TMT test scenario. In case 1, the middle-aged male with classic representation. In case 2, elderly female with hemodynamic compromise. So, 53-year-old male with hypertension and family history of cardiovascular disease. What are the TMT findings in this case? The ST depression, angina, normal BP response, and changes persisted 4 minutes into recovery. So what should be the interpretation? Strongly positive test suggesting significant right coronary artery disease. Next, elderly female with hemodynamic compromise. If the 61-year-old female with diabetes and a typical chest discomfort, and the findings are like this, and the interpretation will be high risk positive test suggesting left main or multivessel disease. So in this way, the positive TMT test can be interpreted. So limitations and false positives. So no CAD causes of positive TMT. Left ventricular hypertrophy means if somehow the left ventricular is enlarged. Hypertrophy means enlargement. Electrolyte disturbances, especially hypokalemia, means amount of potassium is less. Next, anemia, digitalis effects, cardiomyopathy, significant valvular. If there is any problem in the valve like aortic stenosis, the valves are stiff, not opening properly. So these are the non-CAD causes of the positive TMT. Now, what are the technical and interpretation challenges? Baseline ECG abnormalities, then poor electrode contact, means these are the part of the technical issues which can cause some variations in the report. TMT detects approximately 68% of significant coronary artery disease cases with higher sensitivity for multivessel disease. So 68% positivity means sensitivity is there. The test correctly identifies about 77% of individuals without significant coronary artery disease. So this is the specificity level. And false positive rate is only 10 to 30% more in women and individuals with certain baseline ECG abnormalities. What will be the next step if there is a positive TMT? So diagnosis should be confirmed. A positive TMT typically requires confirmation with one or more definitive tests. If a person shows positivity in TMT, he or she should go for the coronary angiography, which is the gold standard, means the very effective identifying test. Then CT coronary angiography, which is a non-invasive alternative of coronary angiography. Then stress echocardiography or nuclear perfusion imaging. You already know that in case of nuclear perfusion imaging, a tracer is also inserted. Then cardiac MRI, myocardial infarction with the stress perfusion. So these are the tests that should be done to confirm the positive diagnosis of the TMT. Now assess the severity, determine the extent and significance of coronary artery disease, location and percentage of stenosis, then single vessel versus multi-vessel involvement, functional significance of lesions, left ventricular function assessment. So these are the severity that can be assessed. How this can be managed? Medical therapy can be done. considerable for revascularization, PCI or CABG, risk factor modification, lifestyle changes, very important. So do like, share, subscribe, and like my channel, and be with me to get the notification of newly uploaded medical and paramedical subject related videos to enrich your knowledge and to also do better in the exams. Thank you so much for your patient listening. Wait for my next video. So long. Bye bye.